Hello everyone, welcome to our Dental Talk Without Secrets, and today we're going to be talking about direct veneers on the discolored teeth, okay? I don't mean extrinsic stains on the tooth, okay? Extrinsic stains such as stains from coffee, from wine, from smoking, okay? That's not our point here. We're going to be talking about white spots, intrinsic stains, or darker spots, also intrinsic stains, stains from fluorosis or stains from tetracycline, okay? These stains, they can be shallow or deep lesions, okay? And how do we figure out if they're shallow or if they're deep lesions? The easiest way to do that is through transillumination, okay? You have here two central incisors with white spots, and when I do a transillumination here, I'm using a curing light from Ultradent, which is the Velo, and I'm using a special tip, which is a green tip that I put on the device, and then I have a green light. But you could use just the light from the curing light or an LED light source, okay, that you just have to shine it through the tooth. And when you do that, if the lesion kind of disappears, okay, you can imagine that this is a shallow lesion. On the other hand, if the lesion, if the stain, if the dark spot keeps showing through the transillumination, it's because it's a deeper lesion. Okay, so you can compare here both of them, a shallow one and a deep one. Okay, the causes of this discolored teeth, they can be from trauma, from infection, a condition which is called molar incisor hypoplasia, from fluorosis, and then there are other causes such as systemic syndromes, amelogenesis imperfecta, and genetics, etc. These lesions can also be acquired through demineralization. For example, around orthodontic brackets, when the patient doesn't have a very good hygiene, when you're going to remove the brackets, you're going to see a white spot, an acquired white spot around where the bracket was. Okay? Regarding the shallow lesions, to treat them, the first thing you should do is to do a tooth whitening, okay? Because when you do the tooth whitening, the value of the tooth rises, okay? You have a lighter tooth, so then the stain is not so visible anymore, okay? So it's the easiest way to do that. But even after you're doing the tooth whitening, you can still see the stain. I'm talking here about the shallow lesions, okay? You can do what is called microabrasion. Microabrasion was described by Ted Crow, which is this fellow here, very nice guy from the United States, where he imagined that would be a good idea to mix hydrochloric acid, 18%, hydrochloric acid and pumice, and then scrub it on the surface of the tooth with a wooden wedge, okay, with a wooden spatula. You just scrub it around the tooth, and that will remove a little bit of the lesion, and also it will give you a different impression, a visual different impression of that lesion. Okay, today we have some dedicated products to do that. You don't have to mix them anymore. So you have the Opalust from Ultradent, the Whiteness RM from FGM, which is a Brazilian company, but you can have them around some parts of the world, and also the Prema from Premier. Okay, and you can also do resin infiltration using this product from DMG, which is called Icon. Okay, so when you have a shallow lesion, it's easier for you to address that. But okay, and also if none of that, even though it's a shallow lesion, if none of that works, you can also remove a little bit with a burr and then do an enamel composite restoration. Okay, so these are the protocols for shallow lesions. Regarding the deep lesions, when you have enamel and dentin involved, I mean deep dentin involved on the lesion, okay, you also do the tooth whitening. That's the first thing you do, okay? Many times, if you have that very large white stain, sometimes you feel that the stain looks smaller. The stain is still there, but it looks smaller, so sometimes it's easier to treat. And then after that, you have to remove this stain. You remove that white spot mechanically with burrs, unfortunately. So sometimes you make like a big hole on the tooth, but that's the way to remove it, okay? You have to bevel a little bit the preparation, and then you can use an opacious dentin on the bottom of the lesion, okay, above the on the surface of the beyond the enamel dentin interface, okay. You don't stop that on the enamel dentin interface. You don't stop there, okay. You go over the enamel a little bit, okay. You should leave just half millimeter to do the enamel composite on top of that, okay. So the enamel composite should be only 0.5 millimeters thick, right? So sometimes the opacious dentin, the dentin composites, sometimes they have a very high value. And depending on the tooth, depending on the case, if they get too close to the surface, and if the value of that composite is too high, you can have also a white spot from the composite. So sometimes you can use a body composite. Body composites are those composites like you have at the V350 or Supreme from 3M, and also Forma from Ultradent, okay? So those composites, they have not only enamel shades and dentin shades, they have what it's called the body shades. Body shade has an opacity which is between the opacity of the dentin composite and the enamel composite. So it's not, it doesn't have a very high value. So sometimes we use this body composite instead of the dentin composite. But on top of that, you can use either chromatic enamel or achromatic enamel. All right? You can also, if even after you do like a deep preparation over that lesion, you can remove that. But sometimes on the bottom of that preparation, you still have some white spots, some very small white spots. You can use, before using the composites, you can use after the bonding agent, you can use a little bit of gray tint, because the gray tint will bring the value down a little bit, okay? So those lesions, which used to be white, they will look more, less appearing through the future restoration, okay? So the gray tint will lower the value of those lesions, okay? If they are still remaining on the bottom of your preparation, okay? You can also use some opacifier, okay? But not just any opacifier. It has to be a very light opacifier, such as the Creative Color from Cosmedent. They have a bunch of opacifiers from different shades, but the ones I use most are the shades A2, A2.5, this is one shade, and then the other shade is A1, B1, LO, light opaque, okay? So those are the two shades that I really like to use, but sometimes we can put them on the bottom of the lesion, okay? So let's see this clinical case here. You can check through the video that I'm showing you here. You can see that the lesion is below the surface of the enamel. Oops, sorry about that. You can see right here, let me stop here a little bit. You're going to see here that you can see the crack from the enamel here, crack from the enamel. You can realize, you can imagine that the lesion is really below the surface of the enamel. So it's a pretty deep lesion, as the transillumination showed us, okay? So this is the case. See here, you can have a better vision of the lesion below the surface of the enamel, okay? It's not on the top of the surface, okay, on the buccal surface. So now with a round diamond burr, I'm removing the white spot, okay? It's a very deep white spot. I keep removing until I have enough space so that I can mask the bottom of that lesion. I'm going to do that with both teeth. Of course, the one on the right is going to be a deeper preparation than the one on the left, okay? So now I'm going to do first the tooth number 8, okay, the right central, and then the left one. I'm going to do a total etch. I start with the enamel, and then I put on dentin. I count 15 seconds, then I wash it out, everything, okay? And then I'm going to use the universal bonding agent from 3M, okay? I'm going to scrub it all over the preparation, all over the tooth, and then I'm going to evaporate the solvent, polymerize it, and now you can see here that I'm using the gray tint to lower the value of those remaining lesions that I still have on the bottom of my preparation. And now I'm going to use the body composite because the lesion is not too deep. So I was afraid to use a dentin composite, and the dentin composite keeps shining through my restoration. So then I would have a white spot from the restoration, which is not ideal. So I'm using a body composite instead of using a dentin composite. So I'm using the body composite. I'm doing some mamelons design. Okay, so this body composite I'm using as if it was a dentin layer. Okay, after doing the mamelons, between the mamelons, I'm going to do an opalescent. I'm going to use an opalescent composite, okay, only in between those grooves, okay, and then on top of everything, I'm going to use a chromatic enamel, and that's it. That's our restoration. After finishing that tooth, I'm going to do the same thing on the other central, and after that, I'm going to do my finishing and polishing of the restoration, okay? The restoration is almost a full veneer, but it doesn't go all the way close to the gingiva, okay? It will keep like 3-4 millimeters before the gingiva, okay? So I can start doing the grooves, you know, the development grooves, the vertical grooves on the surface of on the buccal surface of the tooth. I can do it with a sable brush, okay, that will help me do the anatomic details of the secondary anatomy, and that's it, okay? That's it. That's the restoration. I'll repeat the same thing on the other tooth. And here you have both of them. And here are the materials that I used, okay? As the body composite that I put on the bottom of the restoration, I used the Z350, which in some parts of the world, it's called the Supreme from 3M. I used the B body, B1, okay? Of course, before that, I used the universal bonding agent, the color, the gray tint from Empress Color, okay? I also used, for the opalescent effect, the Z350 or Supreme BT, which is the blue translucent. And then on top of everything, I used the Estelite Omega EB1, okay? Enamel B1. So these are the materials that I used in this case. This is the restoration before and after, and here after a few weeks. I hope you enjoyed it. That's it. You know, it's a kind of simple restoration. It's not too tricky, but you always it always gives you, if you follow the protocol, a very good result. Okay? Thank you very much for watching. See you next time.